I'm Haley Hendrickson, and why I was interested in doing the Bates method was because I wanted to learn about how it helped the eye and the growth with doing the treatment. And my contribution to the project was making the video and learning the basics about the Bates method.
I'm Wesley Chang, and I was interested in whether the Bates method was true. And for this project, my contribution was disproving the Bates method.
Hi, my name is Albert Chen, and I was interested in how the eye functions, and my contributions to this project was explaining the background necessary to understand the Bates method.
Nationwide, over 40% of all Americans over the age of 70 will acquire some type of stress-induced eye disorder, ranging from myopia to glaucoma. In response to these eye conditions reaching epidemic proportions, numerous treatments and techniques have been developed to reduce or even improve eyesight. Despite these attempts, many of them are ineffective and risky to perform. This causes distant objects to be blurry while close objects appear normal, with symptoms including headaches and eye strain. Severe nearsightedness increases the risk of retinal detachment, cataracts, and glaucoma. The underlying cause is believed to be a combination of genetic and environmental factors. Risk factors including work that involves focusing on close objects, greater time spent indoors, and family history of the condition. The physiological mechanism involves the length of the eyeball growing too long, or less commonly, the lens being too strong. Over 5% of people worldwide with eye disorders attempt this technique at some point. This method is most prevalent in the Eastern Hemisphere.
The Bates method is an alternative therapy aimed at improving eyesight. Eye care physician William Bates thought the cause of nearly all eyesight problems was due to the habitual strain of the eyes, and felt that glasses were harmful and never necessary. The palming method suggested closing the eyes for a minute at a time to help bring out relaxation. He asserted that the relaxation could be deepened in most cases by palming, or covering the closed eyes with the palms of the hands, without putting pressure on the eyeballs. Rotating was another method that revolved around the manner of eye movement could affect the sight. He suggested that shifting or moving the eyes back and forth to get a illusion of objects in the opposite direction would be beneficial. He believed that the smaller the area over which the swing of your eyes moved was, experienced the greater and benefit to sight. Sunning was another method that Bates used, and he believed that eyes were benefited by the exposure to sunlight. He stated that persons with normal eyesight can look directly at the sun or at the strongest artificial light without injury or discomfort.
Supporters of the Bates method are under the impression that a person becomes nearsighted because the muscles around the eyes are too tense, restricting the mobility of the eyes. Their solution, the Bates method, revolves around performing eye exercises to relax the muscles and reduce eye strain. However, there are two main factors that affect how well you can see: the length of your eye and the curve of your cornea. If you are nearsighted, then you would have a long eye and a steep curvature of cornea. In order for some sort of alternative natural treatment to make you see better, you would have to alter the length of your eye or the shape of your cornea. After considering this, one essential question can be raised. Is it possible to change the length or shape of a body part by relaxing and rubbing it with your hands? In addition, there is difficulty in testing the Bates method scientifically due to the emphasis on relaxation and visualization. How can we tell whether someone has relaxed or imagined something, or just thinks that he or she has imagined it? Some exercises involved in the Bates method can be regarded as highly questionable. Take palming, for example. According to the Bates method, when you close your eyes and palm them, you see a perfect black if your eyes are a normal 20/20 vision, and gray shapes or colors if you are farsighted or nearsighted. The truth is, nobody, whether their eyes are normal, can see a perfect black when their eyes are closed. A healthy eye is never free from luminous sensations. What one sees is a slightly luminous field that is neither black nor white, but a subdued gray. There may be spots of ribbons of light or luminous clouds, but this is due to the intrinsic light of the retina, caused by the mechanical pressure of the blood against certain cells within the eye. It has no possible relationship with nearsightedness or farsightedness.
Overall, the Bates method fails to cure or even improve the symptoms of clinical eye disorders, such as myopia or glaucoma. The failure is due to two primary reasons. First, the length of the eye, which causes nearsightedness or farsightedness, cannot be changed in response to eye movements. Secondly, the curvature of the cornea cannot be altered due to eye exercises, similar to the length of the eye. The resulting astigmatism cannot be treated with following techniques.